here at Capital District Sport and Fitness with our third episode of PT to the Gym. Today we're going to talk about anterior hip pain, hip impingement. When I see it, typically it's someone who comes in saying, hey, my hip flexors feel really tight, I'm getting pain in the front of my hip when I'm squatting or when I'm sitting a long time. Mike,
and we'll see similar things or hear similar complaints in the gym. Most often when people are squatting, whether there's a pinch in the front of my hip or the inside of my hip, or the front of my hip feels tight and it's kind of limiting my range or making my squat feel awkward. And we'll talk about kind of some modifications you can make to your squat to potentially make that more comfortable, take away your symptoms, and allow you to train the muscles you want. Or maybe look at option B, where you have to reroute and maybe choose different exercises for the time being to get you where you want.
Yeah, so typically what we see is people complaining of that anterior hip tightness, hip flexor tightness. And what we like to do is try and do a Thomas test. So Mike, hop up here. This is a very easy way we can see if we in fact do have some hip flexor tightness. So let's have you hold the right leg up and let that left leg go down. So what we're doing here when we're doing this test is we're looking for that thigh to get down to the table. And so you can see here with Mike that thigh rests on the table nicely. That foot comes down towards the floor, so he's not working with any anterior or any hip flexor tightness here. Well, if you had hip flexor tightness, what we would see is that leg kind of sitting up a little bit higher. So typically, when people come in complaining of, people typically complain of that hip flexor tightness, and we do this test, we don't actually see tightness in that hip flexor. And what we actually see is weakness in the front of that hip flexor. So today in this episode, we're going to talk about three major things. We're going to talk about putting too much pressure into the front of that capsule and not having enough hip flexor strength. We're going to talk about how the adductors get neglected, mobility and strength in those adductors, and then continuing to work on that posterior chain strength. Continuing to work on those muscles that pull the head of the femur back and away from the front of the hip so we don't get that pinching. All right, so here we're going to talk about a couple things that we actually want to try to avoid when we're feeling that pain in the front side of the hip. Like we were saying earlier, you don't want to put too much pressure into the front part of that capsule of the hip, because the ball of the hip will start compressing some of the structures in the front side of your hip and giving you that sensation of tightness and pain. So one of the common ones here is this half kneeling stretch. Great to loosen up the front side of that hip, but what you want to be careful of, as you'll see Mike here do, he's going to overextend a little bit and he's really going to force the ball forward in the socket. If you're having hip pain in the front side of that hip, when you're doing some of these exercises, you really want to try and avoid putting too much pressure into that front of that hip. This will be the same if you're doing the couch stretch where this leg will come up either on the wall or being held up. Similar thing. A second one you want to try to avoid is let's go into that Spider-Man kind of move. Is really forcing that hip down in this lengthened position. So sometimes you'll see this with a Spider-Man lunge or the world's greatest stretch. And what Mike's doing, he's really pressing he's over pressing into that hip and putting a lot of compression in the front side of that hip. So if you're feeling that anterior hip pain, these are a couple of things that you might want to avoid. And where I like to start is actually doing some light hip flexor strengthening. So we're going to have Mike lie on his back. We're going to get a band that's going to go right around his feet here. And what I like to do is just a light supine march. So he's going to lie on his back. He's going to get engaged through the core, hands down at his side. And he's just going to march one leg nice and easy up towards his chest. Good. He's going to hold there for a second, and then he's going to come back down. And he's going to switch sides. So what we typically find is those hip flexors are actually a little bit weak, which is what's causing some of that tightness. And so what we start with is a little bit of light strengthening here. And this is one of my first go-to hip flexor strengthening exercises. And what you'll see next is Mike and Dan talk about how we can modify in the gym to avoid some of this anterior pain in the hip.
This is Mike and Pat back at Capital District Sport and Fitness, and now we're going to talk about how some of that hip impingement may play into your squatting, or talk about more so why you notice that impingement only when you are squatting. So Pat is going to get set up in the squat rack, and just understand like everybody's going to have different hip anatomy. We're going to have different mobility deficits, and so everybody's squat isn't going to look the same. But there's a few key things that we want to be looking at. And Pat's starting with the back squat here, which is a more common variation. And he's going to go through a few reps right now. And a couple of things you'll often see, especially if you are having some pain in the front of that hip, is that while you squat down, it's almost going to look like your hips are dumping back and your torso is dumping forward. Now this may be because you have either, we can stand back up, you either have a lack of mobility in the hip, maybe it's a lack of mobility in the ankle, or maybe it's a hard time with you controlling kind of your rib cage and your pelvis to keep your core and spine in a good position. So Pat's going to rack it in right here. And now if you're having that hip pain and your squat just feels awkward, the first modification we're gonna make is switching to a front load. So Pat's here, he's now gonna front rack the bar, and what this is gonna do before we even squat down is because the load is now shifted more to the front of your body, you're gonna have a chance to kind of engage the abs more, keep this kind of pelvis and rib cage position a little bit more controlled and stacked on top of each other. That way when we squat down, Pat's gonna show you, we don't have that kind of leaning forward and we stay more vertical from the shoulders down to the hips, and then we can push and stand up here. Now the second modification we may need to make is going a little bit wider with your feet and also out-toning slightly with the feet. This is then going to give the hips more room to move in the socket. So if you're someone who maybe has good control over the pelvis and the rib cage, but lacks true hip rotation and hip rotation that you can control, this out toe Pat's going to show you may give you a chance to be able to squat a little bit deeper. Just think now your hips only have to rotate kind of back to a neutral position, which instead of going farther than they should. We're going to push and stand through the heels right now, and let's rack it in right here, Pat. The last modification we may make is just shortening the range of motion. So if you have a decreased hip flexion range of motion, it may be harder to get down to that bottom of the squat position while keeping your spine and hips in a good spot, and kind of getting to these less than optimal positions may cause some of that impingement and pinching in your hip. So all Pat's going to do now is use the box as a guide to shorten that range of motion. And now hopefully we can kind of find a range that his body has that he can control, that we'll be able to squat through and hopefully stay asymptomatic and pain-free through this shortened range. So we can and remember guys, everybody has different anatomy in their hips and different mobility. So you can't expect all squats to look the same or have to be the same. Like we all don't have to be toes straight forward, shoulder width with the bar on our back. We may need to make slight modifications to keep you healthy over the long run, continue to train your squat, and continue to get your lower body stronger. So remember, don't be afraid to maybe try a front load, or maybe limit your range of motion slightly, or adjust your foot position to be able to train the muscles you want and stay healthy over time.
All right, it's Pat again from Suarez Physical Therapy with Dan here from Capital District, and this topic is going to be the adductor. So this is our second point. A lot of times the adductors get overlooked when training, and actually they're very involved when you're squatting deep or you're getting into deep knee and hip flexion. And it's just a movement that that we overlook and can help a lot with our mobility and our strength in our squats while we're working on our performance routine. So what we're going to do here is take you through a little bit of a progression that I like to use when we're trying to train the adductors. All right. So we've got Dan here. We're going to have you stick one leg out to the side. He's going to go into this kind of quadruped position with one leg out long. And all he's going to do is he's going to sit those hips back onto his heel. And we're looking for a nice stretch on the inside of that thigh. He's working on that mobility. Good, come on back up and then back down. And we're going to do about 2 or 3 reps here. And what I like to do from here is we like to progress to adding a load and coming upright. So you're going to sit upright now. We're going to give him a kettlebell. He's going to kind of hold that in front, elbows tucked in tight. Now from this position, he's going to hinge his hips back. And now this is going to be more like his squat pattern, okay? He has a little bit of a load in the front, and we're working that same movement. Good, he can drop that. So we like starting with those two because the floor gives us a lot of feedback. And then what I like moving to is actually engaging that adductor a little bit. So we're gonna have a plate on the floor here. But Dan, put the plate on your left foot for me. And we're gonna have Dan lunge out to the side, and he's actually gonna drag that plate back in with him. So go ahead for me there. And yep. And so if you look, hold the lunge position again. So now if you look, he's in that position we had just there on the floor, right? The same position, but now he's up in the air, he's up on his feet, and then we're gonna slide in. Now we're gonna contract that adductor to come on in and use that. Good, so we go from more stable position to a little bit more dynamic position, and the last one I like to progress to adds a little bit more dynamic to it, a little bit more stability, so you're gonna balance on one leg. All right, he's gonna balance on one leg. He's gonna keep this leg straight. And so this is a good one for our field sport athletes, our soccer players, lacrosse players, to train that cutting and planting. So he's gonna drop into a lunge on that outside foot, and then he's gonna push back up to that balance point. Good. Do about 2 more of those for me, Dan. Good, and relax. So that's a little more dynamic, includes a little more hip stability while using that adductor. And we see a lot of groin and adductor strains in our field sport athletes, our baseball players, lacrosse players, football players that have to plant and cut. And this progression is a great way to start working on those adductors and that mobility on the inside of your hip. If that's not something that you've done yet, this is a great place to begin before transitioning it into your performance routine. And so Dan's going to take us through some exercises that when we're ready from this standpoint to transition into our strength routine here.
All right, Dan and Pat here. We're going to go over some ways we can strengthen the adductors. Pat already talked a little bit about the importance of the adductors when it comes to the squat and it comes to hip impingement when it's not the hip flexors giving you the problems. So the first thing we're going to do here today is Pat is going to go through a lateral lunge with us. The lateral lunge is going to stay in the frontal plane. He's going to step out to the side. The trail leg is going to stay straight, and that right leg is going to bend. So he's going to push his hips back. So a common mistake that we will see with a lateral lunge. That common mistake we'll see is we'll see our athletes and our clients push that knee forward and their knee will continue to move laterally. When in reality, what we want them to do is go back and do a whole full another rep. In reality, what we want them to do is take that stride and push the butt back, keeping tension, good, and driving back up to that foot with that foot maintaining a flat position. One way we can kind of cue this with our clients is with a counter weight. So Pat's going to go ahead and go through another rep here. As he goes into that lunge position, he's going to extend that weight out in front of him. Go ahead. Good. What this counterweight's going to do is allow the abs to work more efficiently, and it's going to allow us to get in a more natural position in that lateral lunge. Good. Sit that one down. Now from there, if we want to add a little bit of intensity to that lateral lunge, add a little bit of weight so the resistance is a little more, man, I don't even know what I'm saying now. Difficult. What we're going to do is move to a landmine lateral lunge. Now you can use a landmine instrument for this, or you can use a dumbbell in a goblet hold, but what we're going to be able to do there is load up this lateral lunge a little heavier. So for that same position, Pat's going to go hand stacks here because we don't want to offset anything by going offsetting hands, and he's going to go through another lateral lunge hold. So he's going to push those hips back, drive back to that front side hard, and get back to that starting position. Give me another one here. Good. Utilizing the landmine is really going to allow him to get into a more natural position to work those adductors in the frontal plane.
Okay, so earlier on we talked about if you're experiencing hip pain or pinching the front of your hip while squatting, that we have probably one or two options. We either can work on modifying our squat, changing your position or limiting your range of motion, or maybe taking some time off from your squatting, letting that hip heal and rehab, and rerouting with your lower body exercises. So right here are one of those reroute exercises that we're going to go over, and this is a barbell glute bridge. It's another great way to train that posterior train, the glutes and the hamstrings like Pat just talked about, but while not worrying about going into that deep loaded hip flexion. So here, Pat's set up with the bar on the floor, and really it's going to be simple with this one. We're going to focus on three main things. The first is really bracing and squeezing the abs. And you'll feel your abs squeeze right into that bar pad that you're using. The second thing is going to be pushing the heels through the floor, and then from there we're going to squeeze our butt up to the ceiling. So Pat's going to go through a rep right here. We're going to hold, we want to feel the glutes and the hamstrings working at the top, and then we're going to lower and control down. So with three simple steps, we're going to brace the abs, we're going to push the heels through the floor, and then squeeze the butt up to the ceiling. And again, this is another great way to train the lower body without worrying about that stress on the hip joint, and also not worrying about any stress in the lower back or mobility restrictions, really limiting how much weight you can load. The single leg deadlift is another great option for us to train our posterior chain, our glutes, and our hamstrings. Not to worry so much about running into that impingement in your hip. So Pat's going to show us right now what this is going to look like, and there's plenty of different ways to load this. Right now we're just going to do an offset hold. So if Pat's right arm has it, his right leg is going to be moving back. Now our main goal here is to train that left glute and hamstring. So if Pat holds at the bottom, Pat, you feel that left glute and hamstring doing some work, and we're going to push and stand up. And this one can be difficult from a balance kind of standpoint, but we want to think we're like a seesaw. As that heel goes back to the ceiling, the hand's lowering, we're pausing, having good control at the bottom to feel that glute and hamstring work. Again, single leg exercises, whether it's this or lunging variations, are great ways to continue to train the lower body while we're rehabbing and letting your hip heal.
All right, everyone, so that was episode 3 of PT to the Gym. We're talking about hip pain, hip impingement, front side of that hip. And a few things that we just want to remind you of at the end here, a few of the important things from my standpoint are, don't over compress, don't put a whole lot of pressure into the front side of that hip if you're feeling pain in there. It might not be actual hip flexor tightness. And then don't neglect your adductors in the inside of that hip. Working on those can really improve the depth of your squat and get you out of the front side of that hip.
Yeah, from a standpoint of being in the gym, you have to recognize that there's not one correct way to squat. You need to figure out what the best way is for you, and whether that's making a modification to the variation that you're squatting with or to the positioning of your body. Just understand that you may need to make those modifications to be able to continue to train your squat over time, to build strength, put on muscle, and stay healthy.
And then the last thing for me is our body moves in all planes of motion, so don't neglect the other planes. We're constantly working in the sagittal plane, but don't be afraid to work in that frontal plane with lateral lunges and exercises of that nature, and don't be afraid to utilize those single leg exercises when it comes to the legs and hips.
Great, so if you guys have any comments or questions, feel free to leave them below. We look forward to next month's episode. And check us out if you want more information. Go check us out on our Instagram accounts, and hope to see you there.